I'm saying they had really none of these. But fast tracking COVID was very effective because we had our MySejahtera. It was an app. Now, is that digitalization of some sort?
Definitely.
Okay.
So just to clarify one
Right.
thing, prior to COVID,
Right.
we didn't have EMRs.
You-
We did have
electronic medical records. Okay.
We did have not quite a number of facilities. In a nutshell, about less than about 13% of our facilities digital.
So out of 13%, so the ministry has got
We have got 150 hospitals,
150 hospitals
We've
and
got
about 1,100,
1,118 primary healthcare clinics.
which is the clinic is here.
Yeah, and about 2,000 over rural health clinics.
Okay.
700 dental clinics.
Okay.
So out of that,
Okay.
less than 13%.
Less than 13%.
Who had some sort of digitization or to a little bit of an extra digitalization
Okay.
already there.
Okay.
But of course, that wasn't enough.
Right,
It wasn't
obviously,
enough,
yeah,
definitely,
yeah,
right?
yeah.
So COVID-19 definitely spurred. It was the catalyst.
Yes.
It actually was the only factor which brought digital health into prominence,
Yes, absolutely.
besides public health.
Yes.
How, when you mentioned MySejahtera, of course, that was actually a public health marvel
Right.
at that point of time.
Yes.
How we used that single app
Yeah.
to manage and augment the entire pandemic management.
Absolutely.
And if you look at literature, data.ai
Yeah.
has ranked Malaysia as one of the best country
Yeah.
to manage the pandemic
Yes.
with the aid of some sort of a digital tool.
Right.
A few things that we very, very quickly I can say and
Sure.
MOH is really proud of
Right.
is how we managed COVID-19 patients, especially Cat 1, if you remember,
Yes,
all
yeah,
those
category 1.
mild COVID-19 infection, how they were managed at home.
Right.
Can you imagine? They could report themselves of being positive.
Right.
They could monitor themselves on a daily basis.
Yeah.
If they had any deterioration of any sort,
Yeah.
as someone who will come to your aid,
Right.
and eventually also get a home surveillance order at that point of time, you remember,
Yeah. Yes.
and eventually discharge yourself
Yes.
end to end. And a fantastic story I would like to share with you
Sure.
was during COVID-19 at the height of it.
Right.
The biggest COVID assessment center
Right.
was Stadium Malawati.
Yes. In
Right,
Thailand,
they were
yes.
seeing close to about 6,000 patients a day.
Wow. Okay.
And all our dear friends, all our healthcare workers were all suited up like astronauts,
Yes.
without air-cons, just burnt out looking
Yeah.
at patients.
Yeah.
And that was the turning point. We had digital drivers, we had digital enablers at that point of time.
right.
All our high-level management looked at real-world data.
Right.
They thought, never mind, all these stable patients can be monitored at home.
Right.
After having this end-to-end digitalization,
Right.
we reduced the number of patients from 6,000
Right.
to less than 1,000 in just 2 weeks.
In 2 weeks.
In just 2 weeks.
Wow.
Right? And this showed the power of having a digital tool,
Right.
having real good decisions at that point of time,
Right.
and executing it. I think that was important.
Yeah.
And not only that, during our vaccination program,
Yes.
we managed to vaccinate more than 90% of our population
Yeah.
4 months before target.
Right.
How? Using the database that we had,
Yeah.
identifying the specific population that we had to vaccinate first, and ta-da, you
Yes.
got all of them vaccinated.